Okay, so we are here today to talk about our clinical assessment kit on severe substance use. It's going to be Thor, Sydney, Caitlin, and then myself, Brianna. So we're going to get into an introduction of the assessment. So first I wanted to say what a clinical assessment kit is, and it's basically a kit that encompasses questions or different assessments or anything along those lines that are related to the different domains. So we'll kind of go through 12 different domains, and then we'll have assessments and questions and things like that for each one. And then the purpose of our clinical assessment kit is to screen and assess individuals that are struggling with severe substance use and severe substance use disorder. And then I also wanted to add in just like a few little statistics talking about substance use and substance use disorder, because at the moment it's at a very large high in many like health clinics, hospitals, outpatient clinics, schools, colleges, everything along those lines. So the statistics at the bottom say 21.4% of Americans aged 12 and older have used illegal drugs or misused prescription drugs. About 50% of Americans over the age of 12 drink alcohol. 21.4% of those who drink alcohol have alcohol use disorder, and then 25.4% of those who use illegal drugs actually do have a drug use disorder of some kind. So substance use, severe substance use disorder are at a very large high at the moment. So for the first domain is presenting problem. So obviously for this assessment, we know that our presenting problem is some type of substance use. So the assessment that I picked is the ASSIST screening tool, which is the alcohol, smoking, and substance involved screening test. And then I have the little link for it there. So I picked this one because it screens different levels of substance use and different types. So there were some assessments that only screened for alcohol. There were some that only screened for drugs, but this one really like screened both. And so I thought that was really universal and nice to use. So it can kind of cover everybody. Overall, the assessment only took 5 to 10 minutes is what I read online and through all of the different research articles that I looked through. And so I thought that was an appropriate amount of time because obviously, when you're first talking about a problem, you don't want to have such a lengthy assessment to go through and a very lengthy process. So you wanted it to be somewhat kind of quick, as well as this one is highly reliable and highly valid. That's actually what my annotated bibliography is on, is it goes into how reliable and valid it is. It's given to men who are incarcerated and in jail, and it's given to them while they're in jail. And it actually shows that there's a large percentage of those who are incarcerated who do have severe substance use disorder and have some type of substance use, even still while in jail. And then I also liked that it had a written format and electronic format. I thought that was really inclusive for those who want to do the paper route, or if they want to do it on a computer like they did in the jail. In the article that I included, they did it electronically and on paper format. And it really showed how reliable and valid it is for substance use and how it can be used in all different types of settings, whether that's in a jail, whether that's in a school, in an outpatient clinic, anywhere. This one's really inclusive and really an easier one to use other than one of the more lengthy ones. The next domain is family background and situation. So for this domain, I picked the PHASES 4 assessment, which is the Family Adaptability and Cohesion Inclusive or Evolution Scale. And then there's also the link for that as well. And so I picked this one also because it was really universal, because it didn't only focus on severe substance use, it focused on a lot deeper questions within a family. So it talked about the closeness within a family, or like the family pressures that a lot of people feel. It talked about leadership within families, like if, the certain individual taking the assessment was held at a lot higher of a leadership role, or if they were more like at the bottom of the pack. The closeness, if the family was a really close-knit family, or if it was very just not close at all. So I liked that it was really universal and it had several different questions that could go into more of a deeper feel of the family. And then I also liked that it was a self-reported assessment. I feel like a lot of times when people are talking about their families or family backgrounds, they can be a little more shy or reserved. Whereas with a self-reported assessment, they can kind of read through the questions, write down what they feel, answer how they feel, instead of feeling the pressure of, being asked question after question after question and then feeling that pressure. So I liked that it was self-reported as well. And then the article that I picked for this one was actually a study on alcoholic families who used the FACES-4. It was actually specifically for the husbands who had alcohol use. And the FACES-4 was given to them before they went through a treatment session and then after. And it really showed one thing that they really talked about the most was like the closeness in the families. So the closeness with the father before his treatment, they were really distant, they weren't very close, all those kinds of things. And then after the treatment, it showed that, their relationships were better, their bonds were better, and it really got to show you a deeper change in the family relationships and showed that family support was actually very vital in the recovery. Without these husbands and without these fathers having their families, they probably wouldn't have been able to recover as well as they did. And the FACES-4 really showed how that changed. And then the third domain is the physical functioning and health domain. For this one, I picked the short form 36 health instrument, and then there's the link for that. This is basically a more basic health instrument, but again, it was very universal with the different questions it asked. It asked questions on physical health, mental health, and emotional health. And I thought that that was really important, especially working with those who have severe substance use. A lot of people who have severe substance use are also dealing with mental health issues and emotional issues. And I thought this one was really important because it really hit every single question. It was asking questions about how your physical or emotional health has interfered with your social activities, or, if they were depressed or things like that. So it really showed the mental health side of it, which I thought was important. And then the article that I picked for this one is an article where it's given to people who are going through a drug detoxification program. So they're given the short form 36 before and then given it again at the end, similar to the last one. But this one really showed how the physical health really depended on the mental health. And that was really shown a lot throughout this article, is that those who were working on their mental health ultimately had better physical health at the end. And it really showed how those two really correlate with each other and can be affected on one another, which I thought was really interesting as well. So, yeah.
Okay, so the next one is educational background and school performance. So I took a lot of questions from different kind of sources. So one of them was like a CPS booklet, kind of a supplemental survey for new students entering schools. Also the National Center for Education. I also based some questions off of personal experience doing intake assessments because I couldn't find like one specific assessment for all of the educational background information. So structured interviews can be valid and reliable and that they're the same for everybody. So they're consistent. They Yep, they're the same for everybody. So at the bottom, through education, I found there's different education levels have different kind of substance use for men and women. So lower education affects different substance use in men, so like higher alcohol or cannabis. And then also for women, lower education kind of more on the pill side of addiction, whereas higher education for men, they get more into kind of pills and that sort of addiction. So different education levels are important to know to base kind of on different addictions. Yep, so it's important to understand education levels in clients to kind of get a full background on their addiction. And then the next one for cognitive, psychological, and emotional functioning, I used the Montreal Cognitive Assessment, Emotional Regulation Questionnaire, self-esteem scale, and then also the ACE questionnaire. And through my research and also personal experience, my internship is at a recovery center actually. So we use a lot of these tests with the clients there. So I was able to kind of use both the research and my experience working there this semester to kind of pick the assessments I did. Um, so a lot of substance use, they gravitate towards it because of a lack of coping skills. Um, so that's kind of why I did like the emotion regulation questionnaire. Substance use also has significant cognitive impairments. So different substances kind of have different impacts on the brain. Through research and also at the clinic I'm at, self-esteem is a big issue. So I included that as a necessary assessment for severe substance use disorder. Um, Also trauma, so childhood trauma, like with the ACE scale, that tends to impact substance use. So I thought that was important for the assessment. Um, and like I said, a big impact on the brain. So like brain shrinkage, and then also it affects the neurotransmitters, which can cause kind of changes in emotions and affect memory. So again, that's why I kind of picked the cognitive assessment and then also looking at trauma. Um, yep, I think that's it for that one. Um, so this is an example of the cognitive assessment that I included. So it's just kind of a little visual for that. And then the last one, interpersonal and social relationships. I chose the UCLA loneliness scale and then also the Lubin social network scale. So again, kind of through my research for this assessment kit and then also at the clinic I'm at, these are two kind of key areas to look at with substance use because a lot of times people do feel lonely in substance use, and then also their social networks are also kind of lacking, which those are both kind of key to look at for kind of treatment, because it is an isolating disorder and an isolating behavior. So I did find, for example, women are more likely to hide their substance use, and this can be kind of due to high stigmas surrounding women and substance use. But positive social supports can keep people accountable and kind of help navigate recovery. And yeah, those are the scales I chose for those three domains.
So I'm Sydney, and I'm going to hop into the ethnicity and culture domain. So the first one I chose is a culturegram for mapping the role of culture in individuals' lives. And it came from a treatment improvement protocol book by the Substance Abuse and Mental Health Service Administration. So if you look at the image, it is basically like the family unit and each person within it. And then those are all the different culturegram maps of like reasons for migration and relocation, like social and economic status, like time and community, languages. I'm not going to read them all, but they all of those little squares have independent questions like between 2 and 6 that fall into each of those sectors of ethnicity and culture. So it's kind of a big branch of this is who you are, these are different aspects of your identity, and there's questions within each of those aspects. And the reason I chose this one is because it gives really good background and history to a person's multicultural experience, and that their culture and ethnicity has multiple aspects within it. And then the rationale behind that was that it like encompasses all of these. And then the second one I chose was the Iowa Cultural Understanding Assessment, specifically like the client form, because it also has a clinician assessment. So this is a 25-question tool that assesses cultural competence in the clinical setting. It uses a 1 to 5 scale, so it starts with strongly disagree and ends with strongly agree. In the middle is neither agree nor disagree. It's used to assess ethnic and cultural competence of staff engaging with a client in a clinical setting. So typically this would be done during or after clinical work, and it mostly is for the client to say like, yes, in this setting, like my identities were strongly taken into consideration, or no, they weren't. And it's a 25 question form that spans that. And the reason I chose this is because this doesn't just focus on substance abuse, but it can very well translate to severe substance use, because the clinical setting can be used here. And additionally, like there's so many influences that impact starting and continued substance use, and cultural and ethnic factors often play a role in that, because there's so many components at play in the multicultural setting. The rationale behind this is that it ensures that like these questions aren't just being asked, but that clients feel that their identities are actually being understood and taken into consideration when going through treatment. So it's not just saying, yes, this space was safe. It's more so saying like, did your clinician actually like take your identity into consideration? And the next section, the next domain I'm on was religion and spirituality. So I used the American Academy of Family Physicians HOPE questions. So HOPE is an acronym, which they kind of divide into like hope, and then the next one is organized religion, and the third one is personal spirituality and practice, and the last one is effects on medical care and end-of-life issues. But in the more broader scale, like sources of hope can be peace, love, connection. It's not necessarily based in spirituality and religion. For some people it is. The O covers the basis of if you are part of an organized religion. P is for personal spirituality or practice, which can be something as simple as like mindfulness, yoga. And then the E covers the effects that these different spiritual or religious practices, or just day-to-day behavioral practices, if not religious or spiritual, have on someone's choices, their decisions, their seeking of medical care, and depending on how clinical treatment goes, like what they're willing and not willing to utilize. I chose this because it gives a lot of personal experience context when it comes to treatment, especially because substance use, we often see NA and AA spaces that have religious basis. So it's important to keep that in consideration, especially when those spaces are also utilized by people with spirituality or no religious preferences. And my rationale was kind of that like it addresses more than just organized religion or spirituality, which I thought was important, that it was more of a broad sense of like, if you're not religious, you can be spiritual. And if you're not spiritual, you can be mindful, and everyone has something, whether it's organized or personal or just day to day. And that impacts the way that they not only like live, but how they seek treatment and how they assess like why they make decisions and what's kind of going on. And it also provides like strength in the fact that like we're acknowledging that this is something that's impacting your decision making and how you want to proceed with treatment. And then the last one I had was gender. So I utilized 2 gender identity and sexual orientation assessment questions that came from the UC Santa Cruz Office of the Registrar and the California State University San Marcos Institutional Planning and Analysis Department. So these were basically the set of questionnaires that they encourage people to use in any sort of survey form or any sort of outreach form at the institutions. And the most important part I found about these were that these institutions have inclusive language guidelines regarding gender identity. And some of those guidelines included that there's an opt-out option in questionnaires in case students don't feel comfortable. It also uses non-binary language, so it doesn't just follow the gender binary, and it uses more inclusive language. And lastly, the language ensures confidentiality. So it reminds students that sometimes the feedback they're giving goes in aggregate and it doesn't get reported. And if it's not in aggregate, it's protected, and that their feedback is not going to be used against them if they feel that it could be in a space that they exist within. I also think that it's really important that gender is an aspect of clinical care, because gender inclusive spaces often can create more space for treatment and for assessment that aren't often available, because if you feel that your gender or sexual orientation is being a barrier based on discrimination, it's hard to seek help and seek care and seek the assessment to find out if you do need to be in a clinical setting. So I also appreciated that these colleges use these questionnaires, because in looking at their websites, they are fully transparent about this is the question set that we used in 2004, and this is how it's expanded in 2008. And so it shows how they adjusted and improved their language around gender over time in the past few decades, and the way that that is creating a more inclusive tool of assessment that gets an accurate depiction of who they are trying to assist and what goals they're trying to understand for those people based on their personal identities that they describe themselves rather than a gender binary box that they have to find themselves falling into. And educational settings are often a good place to look because they often do adjust to up-to-date inclusive language using like an educational and evidence-based background. So that's why I utilize their questionnaire system that is encouraged for their surveys.
Is the camera going to switch over to me, or am I all good? All right. So my domain was strengths and problem solving. And I looked at a number of scales. There were a number of resilience scales, including coping skills scales to choose from in the literature. I did find a short scale called the Brief Resilience Scale, and that measures the capacity to recover from adverse events. And it had several use cases. If you break it down, you can see it being used for stress coping assessments. Basically, how does a patient respond to adversity? Identifying vulnerabilities in patients, so you can see if they have a lower resilience and if that is a sign that they may be vulnerable to a relapse, etc. It allows you to tailor interventions. You can look at how their stress management works and how they cope and or build resilience. And you can monitor the patient's progress. So you can track the resilience over time, see if it improves during treatment, et cetera, where they start out at, where they end up at. If there's lowered resilience over time, that may be pointing towards a possible relapse on its way, et cetera, allowing you to investigate what is going on. It also does a risk assessment. Just like I was talking about, it can show you there's a lower resilience rating, which may be a pointer towards a possible risk of relapse. All right. On to the next one. So the next domain I had was income and community resources. There were a variety of studies in the literature that were talking about financial stress, financial strain, and a lot of clinics and organizations focused on substance use treatment that would talk about the impact of financial stress on patients in the form of furthering substance use disorders, leading to relapse, or leading people into substance use disorders in the first place. I did find a study that measured financial strain. The study was called "Are Changes in Financial Strain Associated with Changes in Alcohol Use and Smoking Among Older Adults?" This was a fairly interesting study because they were able to look at the relationship between financial strain and the use of alcohol and cigarettes. Within this study, they designed 4 questions to measure financial strain. With those scores, they were able to find that if individuals suffered a growth in financial strain within a certain parameter, they were much more likely to engage in heavy drinking and heavy smoking. So that was a fairly interesting study. And also, if the financial strain reduced, you could also see a positive health outcome in reductions of drinking and reductions of smoking. So that belayed the importance of measuring financial strain and using questions to measure that construct. All right, and then the next one, potential barriers to treatment. So one of the possible barriers I was looking into was stigma. There were a couple studies that were measuring an individual's self-stigma of substance use that was acting as a barrier to treatment. The scale that I found was the illicit drug use stigma scale. This measures stigma across 3 distinct categories of discrimination, alienation, and perceived devaluation. What they found within their study using this scale was that discrimination and alienation, the responses associated with those constructs, were associated with poorer mental health. And the constructs associated with the responses associated with the construct of discrimination were associated with poorer physical health. And those were both seen by the authors of the study as barriers to treatment. Thus, stigma is seen as a barrier to treatment. All right, and the next one. All right, so for the implications for the clinical assessment, a lot goes into assessing clients, no matter the diagnosis. However, even more so with a diagnosis like substance use disorder, because of co-occurring mental health disorders, clinicians must address the substance use and mental health disorder and treat both. A lot of assessments are widely used over many populations. We have examples from our assessment bank, FACES, or SF36, MOCA, etc. The use of open-ended questions to help get more information than just yes or no, mixed with standardized measures like ASSIST and ERQ. And the one way that we learned we can enhance the effectiveness in clinical services is tailoring the questions to the individual, using more open-ended so that we get the most information possible, especially with substance use disorders, as it's a complicated disorder with many layers of trauma. We need to understand all the domains to see the full picture.
Okay, so the psychoeducation portion with severe substance use disorder through our research, and then also again playing on my internship at the substance use center, educating clients about substance use and substance use disorder is important, because understanding how it affects you and your brain, your emotions, your behaviors, your relationships, understanding the science behind it, why it happens, how it impacts you, they all roll into one another, and understanding why it happens, how it happens, it's important for them in their recovery, and then also helping them help their loved ones understand what they're going through. Through our research and the different domains, there's a lot of mental health comorbidities with substance use. Mental health often kind of plays into why people gravitate towards substance use. So understanding how, again, your emotions kind of have a play is important. Also educating clients about treatment options is equally as important. So different treatment options for substance use can be an inpatient treatment, so like a residential kind of more strict setting, or intensive outpatient treatment, which is what my recovery center is like. So individual therapy, group therapy 3 to 5 times a week, stuff like that. So yeah, also, like your typical AA meetings, Dharma meetings, there's a whole bunch of different kind of substance use meetings that are really helpful. And then, so we do a lot of psychoeducation components in group therapy at my recovery center, and then also through some of the research that I looked at for my domains. So important topics include repairing relationships, coping skills, anger management, looking at spirituality and how that can play a role, like Sydney kind of went into. Also, mindfulness really helps, and also looking at anxiety. So education can really impact clients, and information is just really, really helpful with people with substance use. Education is really key and on all fronts.
So kind of like to tie this all together, the biggest thing we saw is that assessments can be used in several circumstances to cover a bunch of multidisciplinary aspects of a person's identity. So all of those different domains can use either specific domain focused assessment tools or more broad focused assessment tools that have questions related to those domains, because a person has so many different attributes going on in their life that affect developing and using and treating a substance use disorder. And we also noted that like assessments don't only need to have a focus on the current presenting concern, but can be used in multiple settings to cover different areas. So if it's a more general assessment tool, that can be applied to severe substance use, or if it's a very gender specific question, but you want to know more about the gender of a person that may be affecting developing a substance use disorder, and how those can be implemented. So simply put, severe substance use does not need to be the only focus of a tool for it to be helpful in incorporating all of the aspects of one's identity into assessment and treatment. And we kind of saw that the overlapping of these assessment tools, despite their primary focus, helped assess someone as like a whole person and see more of what's going on rather than just this is the primary condition or concern and let's treat this. It looked at them more as like an all-encompassing individual with so many different attributes of themselves going on that these overlapping tools allow us to get a bigger picture of and help them more specifically and in a way that takes those into consideration and actually benefits them and not just a broad idea of a general treatment client.
Okay, and then the last two slides of our PowerPoint are going to be going over us as a group. So our roles and responsibilities. So in our group, we have 4 members. So we each picked 3 domains that we wanted to work with so that we would cover all 12. We each had the responsibility of completing our domains with the needed assessments and questions, with the annotated bibliography, and with the instrument description, as well as anything else that we thought we needed to complete the domain with. The introduction of the paper section. So if you look at our paper, there's an introduction section, and then there's also a conclusion section. Those were completed by Caitlin and Sydney. And then Caitlin also kind of did the general layout and the outline of our paper as well. It kept it all nice and organized with APA and everything like that. We each then had to complete the corresponding PowerPoint slides for each of our domains. And then the additional slides, like the introduction, roles and responsibilities, psychoeducation, implications, all of those were completed by me and Caitlin. And then Sydney also completed the conclusion slide as well. And then the critical analysis of our group process. So I kind of split them up in strengths and weaknesses. So overall, our strengths were task allocation. I feel like the way that we divided the tasks was pretty easy, pretty simple, and I think that was our strength. So everybody kind of picked their own domain and we all worked independently. And then anything additionally, we just kind of picked up as we needed to. Another strength of ours I thought was problem solving. So we kind of helped support each other when we had questions, when somebody didn't know what something meant, or, you know, how like a page limit or anything like that. We all kind of helped each other out with those questions, as well as we also leaned on our professor as a resource. Since there was no kind of example or anything like this, we weren't sure exactly what we were supposed to be doing. So we really used our professor as a resource to give us any kind of tips and tricks on what we were supposed to be doing. So that was really helpful. And then overall, I felt like our cohesiveness was really well. I think generally we worked really well together. We really had no major issues. And just the cohesiveness of the group and like the PowerPoint and everything went very smoothly. So our weaknesses, I would say our weaknesses would have been communication and time management, just because all of us live very busy lives. We're all doing internships and working jobs and, taking other classes, that since this was such a big project, it was hard to like be in constant communication with each other and be, making sure we're getting the project done, because it was such like a heavy project on top of all the other class assignments and different things that we had going on. I would say our group effectiveness would have been a weakness, just because we started a little later, which made us feel like we were a little bit more behind than maybe we would have if we had started a smidge earlier, just because, again, it was a pretty heavy, like hefty, needed project. And then also, I would say a weakness of ours was organization, just because a lot of us are hands-on learners, and really looking at an example and seeing how it's laid out really helps us in a way. And since there was no example or anything like that, I felt like we had to like keep reorganizing the paper. And so like we would do it one way and then we would switch it another way, and then Caitlin would have to go back through and fix it all. So I think our organization could have been a little better, but there was not much we could really do in that aspect as well. But overall, I think in total, we worked really well together, and I think the project went pretty smoothly. And that is it for our project. So thank you so much.